Two gunshots shatter the glass doors of Harlow Memorial Hospital before the security guard even gets to his feet. A woman collapses through the entrance, bleeding from her shoulder, her dress torn at the sleeve. She grabs the first person she sees, a nurse with tired eyes and ink-stained scrubs, and pulls her close with a grip that doesn't match how badly she's hurt. "They're not done," she breathes. "They're coming to finish it." And in the chaos that follows, no one notices that the nurse holding her doesn't flinch, doesn't panic, doesn't call for help. She just starts working. Before we go any further, if you're new here, hit that subscribe button right now and turn on notifications, because this channel drops stories that will keep you up at night. While you're at it, smash that like button and drop a comment telling me what city or country you're watching from. I want to see exactly how far this story has traveled. Now let's get into it. The morning shift at Harlow Memorial Hospital started the way it always did. Understaffed, overcaffeinated, and held together by the kind of institutional inertia that mistook routine for competence. Evelyn Marsh arrived 12 minutes before her shift began, which was how she always arrived. Not because the handbook required it, but because 12 minutes was enough time to read the overnight notes, check which patients had been transferred, and figure out which problems the night crew had quietly buried in the documentation, hoping the day team wouldn't notice. She'd learned that trick a long time ago, in places where missing something in the handoff didn't mean a complaint filed with hospital administration. It meant someone didn't come back. She didn't think about those places anymore, or she tried not to. Harlow Memorial sat on the western edge of Dunmore City, Colorado, pressed between a rail yard and a commercial strip that had seen better decades. The hospital itself was medium-sized by regional standards, 240 beds, a Level 2 trauma center designation that the administration liked to put on their brochures, and a staff that was perpetually stretched thin across departments that were perpetually understaffed. It served a broad catchment area that included 3 rural counties, which meant the emergency department saw everything from farming accidents and highway trauma to the slower, quieter emergencies that came with poverty and distance from care. Evelyn had been working there for 11 months. She had taken the position quietly, the way she did most things. No fanfare, no dramatic relocation announcement, just a lease signed on a 2-bedroom apartment 6 blocks from the hospital, and a set of new scrubs purchased from the uniform supplier the hospital recommended. She told people she'd come from a traveling nurse contract in New Mexico, which was technically true, and left it at that. Most of her colleagues had stopped trying to get more out of her after the first month. She was polite. She did her work without complaint. She stayed late when the unit was short without being asked, and she was quiet in a way that some people found calming and others found vaguely unsettling, like a room where all the furniture was bolted to the floor. The charge nurse for the morning shift was a woman named Patricia Hoover, who had been at Harlow Memorial for 19 years and ran her floor with the particular brand of exhausted authority that came from having seen every possible way a shift could go wrong. Patricia had a soft spot for nurses who showed up early and a nearly infinite tolerance for the weird hours and stranger requests that came with running a busy medical floor. She liked Evelyn. She didn't entirely understand her, but she liked her. "Morning," Patricia said, not looking up from the assignment board. "Double trauma in the ED overnight. Nothing spilled upstairs, but they've got 2 critical holds waiting on beds." "I saw," Evelyn said. She set her bag down at the nursing station and pulled up the patient list. Bed 7's labs are still pending from 2 a.m. Someone should have followed up. Someone should have a lot of things. Patricia finally looked up. "You want the East Wing or the procedure suite this morning?" "East Wing." "Good. Room 14 is going to be a project. Family dynamics." Evelyn nodded and took the printout. She was halfway down the hallway when she heard the footsteps behind her. The specific clip of dress shoes on linoleum that she'd learned to associate with people who didn't spend much time on the floor, but felt strongly that they should be in charge of it. "Marsh." She turned. Dr. Gordon Holt was the floor's attending physician for the week, covering for the department head who was at a conference in Denver. Holt was in his early 50s, with the kind of face that had probably been handsome 20 years ago and now mostly communicated displeasure. He was holding a tablet, and the way he was holding it, tilted toward her like evidence, told her this was not going to be a neutral conversation. "The chart on Mrs. Delacroix in room 9, he said. "Someone entered the medication timing wrong. It shows her BP medication was given at 6 a.m. She told me she never received it. Evelyn kept her voice level. I didn't chart that. I wasn't on shift until now. Your ID number is on the entry. Then something's wrong with the entry because I was not in this building at 6 a.m. She paused. I can show you my badge swipe if you need it. Holt stared at her for a moment. I'm not interested in a debate. This is the second documentation issue in your file this month. The first one hadn't been hers either, but she'd learned quickly that pointing that out in this particular hospital to this particular type of physician produced no useful outcome. What it produced was an audience. 2 other nurses had stopped at the station pretending to look at something on the computer screen, and a lengthening silence that was clearly meant to apply pressure. I'll pull the access logs, she said, and I'll flag it for the charge nurse. You'll do more than flag it. Holt stepped closer, dropping his voice just enough that it required effort to hear clearly, which she recognized as a power move and filed away accordingly. I'm going to be watching your documentation closely for the rest of this rotation. If there's a pattern here, I need to know about it before it becomes a patient safety issue. He walked away. The 2 nurses at the station went back to actually looking at their screens. Evelyn stood still for a moment, not because she was rattled, she wasn't, not really, but because she was doing the mental work of putting the interaction in a box and closing the lid on it. It was a technique she'd practiced for a long time, in contexts where the alternative to managing your emotional response was making a decision that got people killed. Holt was a problem. He was a specific, manageable kind of problem. She would deal with it through appropriate channels when she had documentation to support it. She went to go check on room 14 out. The family dynamics Patricia had mentioned turned out to involve a 63-year-old man named Robert Okafor, who had been admitted 2 days earlier with a suspected bowel obstruction and was now caught between his adult children arguing about whether he needed surgery and his own conviction that everyone should leave him alone to watch the nature documentary currently playing on the room's television. Mr. Okafor, Evelyn said, pulling the curtain back with a light knock. How are you feeling this morning? Better before you people started coming in every 20 minutes, he said, but not unkindly. His daughter, a woman in her late 30s who had the look of someone who had spent the last 48 hours sleeping in a waiting room chair, stood up from the corner. Can you explain what the surgical consult said? Because the doctor yesterday told us one thing and the resident this morning told us something completely different. I can walk you through what's in the chart, Evelyn said, pulling up his file on the room's tablet. And I can flag the attending to come speak with you directly if there's conflicting information, because that needs to be resolved. What followed was 40 minutes of careful, patient conversation. Not the kind that appeared in training videos where everyone asked clear questions and received clear answers and left feeling reassured. But the actual kind, with interruptions and tears, and a moment where the son, who had driven up from Pueblo the night before, said something unkind to his sister and then apologized for it. And Robert Okafor muted the television and told all of them to stop performing their concern for the nursing staff and just talk to each other like humans. Evelyn finished the conversation having established that the surgical team needed to send someone with more seniority to speak with the family, that Robert's pain management needed adjustment, and that the conflicting information was almost certainly the result of 2 physicians looking at the same scan and reaching different conclusions about the timing of intervention. She documented all of it carefully and sent a direct message to the surgical resident with a flag on the family communication gap. She was back at the nursing station writing her notes when she heard Dr. Holt's voice again, this time from around the corner, speaking to someone she couldn't see. The charting issue this morning, he was saying. I've been watching her since she transferred in. She's capable enough with basic tasks, but I have real concerns about her judgment under pressure. A pause. Then another voice. She recognized it as the nurse educator, a woman named Sandra Twigg, who ran the hospital's competency evaluations. Has she had any clinical errors? Nothing documented, but documentation isn't everything. Gordon, if you're going to flag someone for review, you need documented evidence of, I'm making a note, he said, just making a note. Evelyn stayed very still. She finished her sentence in the chart. She clicked save. She went to check on the patient in room 11 Chaktia. By noon, the floor had settled into the particular rhythm of a Wednesday. Busy enough that nobody was standing around, not so overwhelmed that things were falling apart. 2 discharges processed cleanly. An IV line blew in room 6, and Evelyn replaced it without the patient flinching, which earned her a surprised look from the patient and no acknowledgement from anyone else. She ate half a granola bar standing at the medication cart and called it lunch. The ED called up at 12:47. "We've got something coming in," the triage nurse said. His name was Dominic, and he had a habit of understating things. Female, mid-40s, GSW to the left shoulder, and possible secondary thoracic trauma. ETA 8 minutes on the ambulance. They want to know if you can take a hold upstairs if she stabilizes. "What's her pressure?" 82/50 on the last call. They've got 2 large bore IVs in. 82/50 was not a number that suggested upstairs anytime soon. "I'll let the charge know. What's the mechanism?" "That's the part that's getting interesting," Dominic said. He dropped his voice slightly, the way people did when they weren't sure who was listening. "Local PD dispatch flagged it as an assault, but there's a federal call attached. We've got a DHS liaison on the way." Evelyn paused. "A what?" "Yeah, that's what I said." He cleared his throat. "Anyway, just a heads up." She relayed the information to Patricia, who made the face she made when something was about to require phone calls to administration, and went back to her notes. She did not think much of it. Hospitals occasionally intersected with federal matters, patient privacy issues, undocumented patients, the occasional law enforcement escort. It was unusual, but not remarkable. What happened next was remarkable. The ambulance arrived at 12:59. Evelyn was not in the ED. She had no reason to be, but the sound carried up through the stairwell in the particular way sounds moved through old hospital buildings, and she heard the doors and the wheels and the controlled urgency of a trauma team receiving a critical patient. She heard it and noted it and kept working. What she didn't hear, because she wasn't positioned to hear it, was the second vehicle that pulled into the ambulance bay 11 minutes later, a black SUV. Colorado plates, but the kind of plates that, if you knew what to look for, told you the vehicle was federally registered through a state cover agency. 3 people got out. 2 wore civilian clothes. The third wore a uniform. She also didn't see the 2 men who entered through the hospital's main entrance 8 minutes after that. They had credentials. They showed them to the security desk and were waved through. The credentials were federal issue. They were also, as would become clear later, not real. What Evelyn was doing at 1:14 p.m. was standing in the supply room at the end of the East Wing's hallway, pulling a replacement pulse oximeter from the cabinet, when she heard something she'd been trained to hear even when she wasn't trying to. Footsteps that didn't match the building. She stood still. Supply rooms in hospital corridors had a particular acoustic quality. Hard floors, metal shelving, low ceilings, a ventilation hum that absorbed ambient sound. To hear footsteps clearly through that environment, the person making them had to be either very close or very deliberate. These weren't deliberate. They were careful. There was a difference. Deliberate meant purpose. Careful meant concealment. She set the pulse oximeter down slowly, moved to the doorway, looked left. The hallway was empty. She looked right, also empty. But one of the ceiling-mounted cameras, the one positioned at the corridor junction 40 feet away, had its indicator light off. That camera had been working this morning. She'd walked past it 3 times. Evelyn stepped back into the supply room and took 30 seconds to think through what she knew. A critically wounded woman had arrived by ambulance with a federal flag on the call. A DHS liaison was supposedly en route. 2 men had entered through the main entrance, and she hadn't seen them come upstairs, but that didn't mean they hadn't. And a camera was down. None of those things, individually, were alarming. Together, in the specific configuration they were currently arranged in, they described something she recognized. She picked up the pulse oximeter and walked back toward the nursing station at a pace that matched everyone else's pace exactly. And she started thinking about the layout of this floor, the exits, the stairwells, the service corridors behind the supply line, with a quality of attention she hadn't applied to any physical space in a long time. She found out about the patient's identity at 1:31 p.m., not through official channels, but through Patricia, who had been on the phone with the ED charge nurse and came to find Evelyn with the look of someone who was trying to keep her voice neutral. "The woman who came in," Patricia said quietly, stepping into the medication room and pulling the door most of the way closed. "They're saying she's connected to someone significant." "How significant?" Patricia hesitated. "The name I heard was Holloway, as in Admiral Holloway." Evelyn kept her face still. "His sister?" "That's what they're saying." And Patricia glanced toward the door. "There's something else. One of the ED nurses told me the two men who came in through the front, the ones with the federal IDs, they went straight to the trauma bay, and they weren't there to help." "What do you mean?" "She said they were asking which patient was the GSW, not which patient needed assistance. Which patient was the GSW?" Patricia's jaw was tight. Like they were looking for someone specific. Evelyn set down the medication she'd been preparing. She looked at the wall for a moment, not blankly, but with the focused quality of someone running calculations. "Where is she now?" "Still in the ED. They're trying to stabilize her enough for surgery. Her pressure keeps dropping." "And the two men?" "Still down there. One of the ED docs said they've been hovering. Wouldn't let the trauma team work without them in the room." Patricia lowered her voice further. "The ED charge tried to get them to step out, and they showed credentials again, and she backed down." Evelyn nodded slowly. She picked the medication back up and began preparing it again. Her hands were completely steady. "Call security," she said. "I did. They're monitoring the situation." "Then call administration. Also called, also monitoring." The words everyone uses when they don't want to make a decision that might be wrong. She knew what that looked like from the inside. She also knew what it looked like from outside the wire, when the people who were supposed to make a call went quiet, and the situation resolved itself in whatever direction it was going to resolve. "Patricia," she said, "lock down access to the pediatric wing." Patricia stared at her. "What? Why?" "Because if someone came to this hospital to finish what they started with that woman downstairs, and they're not done, they're going to need leverage. And leverage in a hospital means either hostages or chaos." She capped the medication and set it on the tray. "The pediatric wing has the most concentrated civilian population in the building. Lock it down, and don't tell anyone I suggested it. Just do it." Patricia looked at her for a long moment, with the expression of someone recalibrating what they understood about the person in front of them. "Who are you?" she asked. Evelyn picked up the medication tray. "I'm the nurse on the East Wing. I need to get this to room 11. She walked out. She made it to room 11, administered the medication, checked the patient's vitals, updated the chart, and was back in the hallway at 1:47 p.m. when the sound reached her. Not from the floor below, not from the stairwell, but from somewhere that shouldn't have been generating sound at all. The service corridor behind the East Wing supply line. The one that connected, through a maintenance passage that appeared on no public hospital map she'd ever seen, to the old mechanical room on the building's original floor plan. A room that hadn't been used for primary building systems since the 2009 renovation, but hadn't been sealed either, because hospitals rarely sealed things they weren't actively using, they just forgot about them. She knew about it because she'd read the building's architectural records when she moved to Dunmore City. It was something she did in new places. Old habit. The sound was quiet. Almost nothing. The controlled sound of someone trying not to make one. Evelyn stood in the hallway for exactly 3 seconds. Then she turned and walked toward the nursing station, and she picked up the desk phone, and she dialed the number for the ED charge nurse directly. "This is Evelyn Marsh, East Wing. I need you to listen to me carefully, and I need you to do it fast. The woman in your trauma bay. Is she conscious?" A pause. "Intermittently. Why?" "There are people in this building who came here to make sure she doesn't stay that way. I need you to move her, not to a different bay, off the floor. Change her location in the system, and do not update the record with the real room number until I tell you it's safe." Silence on the other end. Then, "Marsh, what the hell is going on?" "I don't have time to explain it in a way that will make sense right now. Is there a physician you trust completely in that department? Someone who will not ask questions? Yes. Get them. Move her. Do it now. She hung up. Down the corridor behind the supply line, something shifted. A weight redistributing. A door that wasn't supposed to open. Opening. Evelyn Marsh turned toward the sound, and for the first time since she'd arrived at Harlow Memorial Hospital 11 months ago, she stopped pretending she didn't know exactly what to do. The door at the end of the service corridor didn't open all the way. It moved maybe 4 inches, enough for someone to confirm what was on the other side, and then stopped. Evelyn didn't move toward it. She moved away from it, back toward the nursing station, walking at the same pace she always walked, the pace of someone with a task and a destination. The worst thing she could do right now was let whoever was in that corridor know they'd been heard. The second worst thing was to be standing in an empty hallway when they came through. She made it back to the station, picked up a chart that was sitting on the counter, and stood with her back to the wall beside the medication room door. From that position, she had a clear sight line down the length of the East Wing corridor. She could see the supply room door. She could see the junction where the hallway split toward the stairwell. She could not see the service corridor entrance directly, but she didn't need to. What she needed to see was where they came out. Patricia appeared from the break room carrying a coffee mug and stopped when she saw Evelyn's face. Evelyn didn't say anything. She looked at Patricia and then looked very deliberately at the stairwell door at the far end of the hall and then back at Patricia. Patricia was 19 years into this job. She understood things without being told them. She set her coffee mug down on the counter and picked up the phone. The service corridor door opened. One man came through first. He was wearing a dark jacket over a dress shirt, the same generic professional attire that could belong to a federal agent or an insurance adjuster or a pharmaceutical rep. But the way he moved through the doorway was not the way any of those people moved. He cleared the frame with his right shoulder leading, weight already distributed, eyes tracking left before his body had fully entered the space. It was a movement pattern so deeply trained it had become automatic, and Evelyn recognized it the way she recognized the sound of a monitor alarm, not by thinking about it, but by the immediate physiological response it triggered somewhere below conscious thought. A second man followed, slightly shorter, heavier through the chest, moving with less precision but more mass. He was carrying something under his jacket that altered his silhouette on the left side. They hadn't seen her yet. The nursing station was recessed slightly from the main hallway, set back behind a low counter, and she was standing in the shadow beside the medication room door. She had maybe 4 seconds before their eyes adjusted to the corridor's lighting and the geometry of the space worked against her. She used 2 of those seconds to make a decision. Then she stepped out from behind the counter and walked toward them with the direct, purposeful stride of someone who had every right to be in this hallway and was mildly annoyed to encounter an obstacle in it. "Can I help you?" she said. Not loud, not aggressive. The voice of someone accustomed to asking the question. The first man stopped. His eyes moved over her. The scrubs, the badge, the chart in her hand, and something in his posture shifted from alert to managed. "We're looking for the nurse's station," he said. His voice was flat in a way that had nothing to do with lack of emotion. "You're at it," Evelyn said. She gestured toward the counter. "What department are you looking for?" "We're federal." He reached into his jacket. "We need access to patient records for a woman admitted through the ED about an hour ago. GSW, mid-40s. He produced a credential wallet and held it open toward her. She looked at it the way a nurse would look at something she was expected to look at, registering it without examining it, trusting the visual without interrogating the details, because most people in a hospital trust a badge without asking hard questions about it. Evelyn was not most people, and what she saw in that wallet told her 3 things in rapid sequence. The laminate had the right color and format, the photo was properly positioned, and the embossed seal was 3 millimeters off-center in a way that the actual issuing agency's production process would never allow. "I'll need to call administration to authorize any patient record access," she said. "Standard protocol. If you want to wait at the station, I can have someone—" "We don't need authorization. Federal statute covers." "I understand," she said, "and administration will confirm that. It usually takes about 10 minutes. She moved toward the counter. "Can I get your names for the log?" The second man hadn't spoken. He was looking past her, down the hallway, doing the same geometry she'd done a minute ago. She felt him cataloging exits. The first man's jaw tightened. "We'll come back," Of course. She picked up a pen and didn't write anything. I'll let them know you were here. They left the way they came, back through the service corridor door. Evelyn put the pen down. Her hands were steady. Her heart rate was not, but that was irrelevant. Patricia, she said without turning around, I heard. Patricia's voice was careful. I've got security on hold. They're still saying they're monitoring. Tell them there are 2 unauthorized individuals in the hospital's maintenance corridor system. Tell them the individuals presented potentially fraudulent federal credentials and were attempting to access patient records without administrative authorization. She paused. Use those exact words. Write them down first. And what are you going to do? Evelyn was already moving toward the stairwell. I'm going to the ED. Ian. The emergency department at Harlow Memorial occupied the entire south wing of the ground floor, a sprawling, perpetually lit space that smelled of antiseptic and recycled air and the particular human desperation that pooled in waiting rooms at all hours of the day. Evelyn had spent time down here during cross-departmental training rotations in her first month, and she knew its geography well enough. The trauma bays along the west wall, the fast-track area near the ambulance entrance, the supply corridor that ran behind the nursing station and connected to the imaging suite. She took the stairs rather than the elevator and pushed through the stairwell door into the ED hallway at a pace that fell just below a run. Dominic met her before she reached the nursing station. He was a compact man in his late 30s with close-cropped hair and the practiced calm of someone who had absorbed too many emergencies to expend much energy on any individual one. Right now his calm had a quality of strain running through it, like a surface with a crack beneath it. You called about moving her, he said. Did you? We did. She's in imaging holding the alcove off the CT suite. We told the system she was transferred to radiology for a scan, which is technically true because we ran her through the scanner on the way. Dr. Ferris is with her. He lowered his voice. Her pressure stabilized. Barely. She's at 90/60 and holding, but the thoracic trauma is significant. She needs a surgeon. She needs to stay hidden more than she needs a surgeon right now. Dominic looked at her steadily. You want to explain what's happening? 2 men in the building came through the maintenance corridors. They have fraudulent federal credentials, and they were specifically asking which patient was the GSW. Not asking to help, asking to locate. He was quiet for a moment. Where are they now? I don't know. That's the problem. She was about to say more when the main entrance doors at the far end of the department opened and 3 people walked in. 2 of them she didn't know. The third was wearing a uniform, a pressed army uniform with the kind of rank insignia that didn't get worn by people who spent their time in offices. And she stopped walking because the sight of it did something to her processing speed that she didn't entirely control. She made herself keep moving. She made herself look at the counter. The uniformed officer spoke to the security desk. She was too far away to hear what he said, but she watched the security guard's reaction, a shift in posture, a slight pulling back, the body language of someone recalibrating who they were dealing with. Dominic was watching too. You know who that is? No, she said, which was true. She didn't know the specific person, but she knew the bearing, the way the uniform was worn, the economy of movement that came from years of carrying responsibility for people's lives. She knew what that looked like. I'm going to get Dr. Ferris, she said. Stay here. If those men come back through any entrance, I need you to call the floor. My cell number is in the directory. She went to find the patient. The imaging alcove off the CT suite was a narrow utilitarian space, a reclining chair, a rolling cart, an overhead light on a flexible arm, a monitoring unit that had been wheeled in from somewhere. The woman lying in the reclining chair had an IV running in each arm, a pressure cuff cycling on automatic, and the look of someone who was conscious enough to be afraid and in too much pain to do much about it. Dr. Ferris, a thin, serious woman in her 40s who ran the ED's imaging protocols, stood beside the monitoring unit with her arms crossed and the expression of someone who had been talked into something and was not fully at peace with it. She asked about you, Ferris said when Evelyn came in. Evelyn looked at the patient. The woman's left shoulder was heavily bandaged. Her color was poor, grayish at the edges, the pallor that came with significant blood loss, but her eyes were tracking. You're the one who called them, the woman said. Her voice was rough. Not weak. Rough, the way a voice got when the body was fighting hard and didn't have resources to spare for the throat. The ones downstairs. You told them to move me. Yes. How did you know? Evelyn pulled a stool over and sat down so they were at eye level. Two men came up to the East Wing asking which patient was the GSW, not asking to check on you, asking which room you were in. That's not how Federal Protective Detail operates. She paused. It's also not how investigators operate. It's how people operate when they want to confirm a location. The woman's eyes moved over her. Something in the look was assessing rather than frightened. You've seen that before. Once or twice? A silence. The monitoring unit beeped softly. Outside the alcove door, footsteps passed. A tech, probably, or an orderly, and both of them went still until the sound faded. My name is Sylvia Marsh, Holloway, the woman said. Sylvia Holloway. My brother is... I know who your brother is, Evelyn said. I heard. Sylvia Holloway looked at her for a moment. I was going to testify. Next week. In front of a subcommittee. She shifted slightly, and the movement cost her. Her jaw tightened, her breath shortened, and she waited a second before continuing. There are people who would prefer I didn't get the chance. I understand. Do you? It wasn't a challenge, it was a real question, with the weight of someone who had spent days not being believed about the magnitude of what was happening to her. Yes, Evelyn said. I do. Ferris cleared her throat. She needs surgery, the thoracic trauma. There's a hemothorax developing on the right side. I can manage it conservatively for now, but she needs an OR. Can you do a thoracostomy here if it decompensates? Ferris blinked. Yes, I have the equipment, but that's not a standard nursing. I know what it is. Evelyn stood. Give me 20 minutes to sort out the hallway situation. If her pressure drops below 80 systolic before then, call me and we'll make a decision. She was at the door when Sylvia spoke again. They're not just after me, she said. There's a file. I had it with me, in the ambulance. A pause. It wasn't in my bag when I got here. Evelyn stopped with her hand on the door frame. What kind of file? Procurement records, defense contracts going back 4 years, names, numbers, transfers. Sylvia's voice was steady in a way that suggested she had decided not to allow herself the luxury of falling apart yet. If someone in this building has it, they're going to know exactly what I was planning to say. Evelyn stood still for 3 seconds. Then she nodded and walked out. Shut. She found the military officer in the main corridor outside the ED nursing station, and she walked straight toward him with the direct approach she'd learned worked better than any alternative when dealing with people accustomed to reading intention in body language. He saw her coming. He was perhaps 55, with the kind of weathered face that came from spending significant portions of a career outdoors and under pressure. His name tag read Calloway. His rank insignia was a colonel's eagle. Colonel, she said. He looked at her with the particular attention of someone who didn't waste attention. You're not ED staff. East Wing, my name is Evelyn Marsh, the nurse who called the relocation. He said it without surprise, which meant someone had told him, which meant communication in this building was moving faster than she'd accounted for. Yes. She kept her voice low. You need to know 2 things. First, there are 2 individuals in this hospital's maintenance corridor system who presented fraudulent federal credentials and were attempting to locate your protectee. I don't know where they are right now. Second, a document, physical file, that Ms. Holloway was carrying may have been removed from her belongings either in the ambulance or on arrival. Calloway processed this without visible reaction. He turned slightly and spoke to one of the 2 civilians flanking him, a younger man with the compact, watchful stillness of someone trained for close protection. Breckett, maintenance corridor map, north and south access points. Now! The younger man moved immediately. Calloway turned back to Evelyn. How do you know the credentials were fraudulent? The seal on the credential wallet was off-center. A pause. Most people wouldn't catch that. Most people aren't looking for it. He studied her for a moment with the evaluative quality she recognized from a different context. The way someone looked at a person when they were trying to locate them within a taxonomy of people they'd encountered before. "What's your background?" he asked. "Nursing," she said. He let that answer sit without accepting it. "The maintenance corridor. You've been in it?" "No, but I know the building's layout. There's a passage on the east wing's ground level that connects to the original mechanical room from the 2009 renovation. From there you can access the service elevator that bypasses the main lobby. It comes out near the loading dock, which is the least monitored exit in the building." "Yes." Calloway was quiet for approximately 2 seconds. "Can you show my team the access points?" And this was where she should have said yes, given him the information, and gone back upstairs. That was the correct, proportionate, professionally appropriate response. She knew that. She also knew that Beckett, competent as he appeared, did not know this building. And the two men in the maintenance corridor did, which meant someone had given them a layout in advance, which meant this had been planned with specific knowledge of Harlow Memorial's internal geography, which meant whoever was helping them from inside the hospital had provided something more detailed than a general floor plan. "Yes," she said. "I can show you." They moved through the hospital with the practiced informality of people trying not to look like they were moving with purpose, which was harder than it sounded in an environment where everyone was in motion, but the motion all had a predictable, department-specific quality. Evelyn led. Calloway walked slightly behind her left shoulder. Beckett, who had come back with a rough sketch of the maintenance corridor map that was substantially incomplete, fell into step on her right. She took them through the ED supply corridor, past the imaging suite, through a connecting hallway she'd identified on the building's original architectural records as a pre-renovation service passage. The hallway was narrow and lit by overhead strips that buzzed faintly at one end where the ballast was failing. She knew where she was going and moved accordingly, without hesitation, which Calloway noticed because she felt him recalibrate his pace to match hers, rather than leading. "The loading dock access," she said quietly, "is through the door at the end of this passage. The service elevator is on the right. The mechanical room, the old one, is behind the secondary maintenance panel on the left. The door looks like a wall panel, brushed aluminum, flush-mounted handle." "How do you know this building that well?" Beckett asked. "I read the blueprints." A pause. "Why would a nurse read hospital blueprints?" She didn't answer. They'd reached the end of the passage. She stopped and held up her hand, and they stopped behind her. From beyond the door at the end of the corridor came a sound, faint but definite. The sound of something being moved. Not furniture, not equipment, something smaller. Paper, maybe? Or the contents of a bag. Calloway and Beckett exchanged a look above her head. "They found it," she said quietly. "The file. They're looking through it." "Can we confirm without opening that door?" Beckett asked. Evelyn looked at the door. It was a standard hospital fire door. Solid core, no window. She turned and looked at the wall to her left. 12 feet back, there was a ventilation access panel. Floor level. 6 by 8 inches of wire mesh over a duct that ran parallel to the corridor on the other side of the wall. "Give me 30 seconds, she said. "What are you—" Beckett started. She was already moving. She crouched at the ventilation panel, worked her fingers around the edge. No screws, just clips. She'd noticed that on the original specs, and pulled it free as quietly as she could manage. She leaned forward and looked through the duct. The mechanical room beyond the panel was not large. She could see the lower half of it through the duct's angle. The floor, the base of an old electrical panel. 2 pairs of legs. One pair was standing. The other was crouching near something on the floor. Between them, partially visible, was a flat document bag. It had been opened. Pages were spread across the concrete. They were photographing them. She pushed herself back up and replaced the panel with her palm, pressing it to silence the clicks. She turned to Calloway. She held up 2 fingers. She pointed at the door. She mimed a camera, index finger pressing a shutter. His jaw tightened. He looked at Beckett. Some communication passed between them in the form of slight movements, eye contact, weight shifts, the abbreviated gestural vocabulary of people who'd worked together long enough that spoken language was optional. Then Calloway looked at Evelyn and said, in a voice barely above a breath, "Get clear of this corridor. There are 2 of them and 1 possible additional outside. I know. Get clear." She looked at him for a moment. He was not asking. He was also not wrong. She had no weapon, no vest, and the passage was too narrow for her to contribute anything useful to what was about to happen. She went. She moved back through the supply corridor and was halfway through the connecting hallway when she heard the mechanical room door come open. Not the fire door she'd been facing, but a second access point on the opposite side. The one she'd known was there because the blueprint showed it, leading into a short passage that connected to the stairwell on the east end of the building's ground floor. She heard it open. She heard footsteps, fast, uncontrolled, the footsteps of someone running, and she understood immediately one of the two men had come out the other side. She was the only person in the connecting hallway. She stopped. She thought very fast about where the stairwell door was relative to her position, where the running footsteps were going, and what the geography of the next 20 seconds looked like. Then she made a decision that was not the safe decision, but was the decision that made the most tactical sense in the 3 seconds she had to make it. She turned around and ran, not away from the sound, toward the stairwell door. She hit it at speed, pushed through, and came out into the stairwell at the same moment the man trying to use it as an exit arrived from the opposite direction. They were 6 feet apart in a space with concrete walls and fluorescent lighting and no audience. He was breathing hard. She wasn't. He was holding something, the document bag. And the act of holding it had occupied his right hand in a way that changed his options. She registered all of this in approximately 1 second. He made a decision first, and it was the wrong one. He came at her with his left hand reaching, going for a grab rather than a strike, which told her his priority was getting past her and not dealing with her, which meant he'd assessed her as an obstacle rather than a threat. The last person who'd made that assessment had been a checkpoint guard in a country she wasn't going to think about right now. She let him close half the distance, then stepped offline, used his forward momentum against his balance, and put him into the wall with enough controlled force that the document bag hit the floor and the impact knocked the breath out of him without breaking anything. She'd need functioning later if there were questions. He was on the ground. She kicked the document bag away from his hand. He looked up at her from the concrete floor with an expression that had moved quickly from shock through reassessment and arrived somewhere that looked, surprisingly, like recognition. "You're not," he started. The stairwell door banged open. Beckett came through it at speed, stopped, looked at the man on the floor, looked at Evelyn, looked at the document bag. He stood there for a moment. "The other one's secured," he said. "Calloway has him." He bent and picked up the document bag. Then he looked at her again with an expression she'd learned to read a long time ago. The expression of someone encountering evidence that doesn't fit the category they'd put you in. She straightened her scrubs. Her shoulder ached where she'd hit the wall during the maneuver. That was going to be a bruise. She hadn't been thinking about the wall when she made the decision, and that was a mistake she'd factor in next time. "The file," she said. "Is it intact?" Beckett checked the bag quickly. "Looks like it. They got photos, but we have their phones." He paused. "Marsh." She looked at him. "Who did you train with?" She picked a piece of concrete dust off her sleeve. "Nobody you'd know." She pushed through the stairwell door and went back into the hospital, and she was 4 steps into the connecting hallway when her phone buzzed in her scrubs pocket. She pulled it out. "Patricia." Text message, 3 words, "Pediatric wing. Now." Evelyn broke into a run. She was running before she'd fully processed what the text meant, because she didn't need to process it. The pediatric wing, the lockdown she'd told Patricia to initiate, the third man she'd accounted for only as a possibility and not a certainty. The loading dock exit that the 2 men in the mechanical room had presumably been heading toward before they were intercepted. 3-person team. She'd assumed 2 because she'd only seen 2. That was the mistake. The pediatric wing was on the 3rd floor north end, accessible from the main stairwell or the elevator bank near the central nursing hub. She took the stairs. Her shoulder was already stiffening where she'd hit the wall in the stairwell below, the bruise developing under the scrub fabric with a dull, specific ache she'd learned to categorize as irrelevant and file accordingly. She hit the 3rd floor door at speed and came out into the corridor at a controlled run that she slowed to a fast walk when she saw the staff clustered near the nursing station at the far end. Patricia was there. 2 pediatric nurses she recognized, A hospital security guard, the same one who'd been monitoring the situation from a distance all afternoon, standing with his radio in his hand and the look of someone who had recently been told something he didn't know how to act on. Patricia saw Evelyn and came toward her immediately. "Room 31, she said. "There's a man in there with a woman and her son. He got in before the lockdown. I don't know how. He had a badge, looked like maintenance." Her voice was steady, but her hands weren't entirely. She was holding a pen she'd been clicking without realizing it. He told the nurse who checked on them that he was fixing the heating unit, but the heating unit in 31 was serviced last week. I checked the log. "How long has he been in there?" 11 minutes. "Is the boy 7 years old? He was admitted this morning for a respiratory infection. His mother has been with him all day." Patricia stopped walking and dropped her voice. "Evelyn, he's not fixing anything." Evelyn was already looking at the door to room 31, which was closed. Standard pediatric wing room, single occupancy, window facing the north courtyard, one interior door, a connecting bathroom with no exterior access. She knew the layout because she'd floated to this floor twice during her first month. "Did you call the police?" Dispatch said 8 to 12 minutes. That was 4 minutes ago. "Calloway." She pulled out her phone. "I need Calloway up here." "Who?" She was already dialing. It rang twice. Calloway picked up. "Third floor pediatric wing," she said. "Room 31. Third individual from the team. He's been inside with a civilian woman and a child for 11 minutes. He got in before the lockdown." A pause that lasted less than 2 seconds. "On my way. Don't go in." She put the phone in her pocket and looked at the door. 11 minutes was a long time for someone to be in a room under false pretenses without escalating whatever he was there to do. That meant one of two things. He was waiting for something, a signal, a window, a distraction, or the woman and the child were already being used to ensure compliance from someone outside the room. She looked at the security guard. "Has anyone called that room?" "What?" "The room, the phone. Has anyone called it to speak with the woman inside?" The guard blinked. "No." She went to the nursing station, picked up the desk phone, and dialed the room extension. It rang 4 times. Then a woman's voice answered, careful, controlled in the way people were controlled when they were being told to sound normal. "Hello? Mrs. Evelyn looked at the board. "Mrs. Navarro, this is the nursing station. We're just checking in. How is your son doing this morning?" A brief pause. He's fine. Resting." "Is there anything you need?" Another pause. Longer. "No, we're okay." "All right, just let us know." She hung up. Patricia was at her shoulder. She didn't say anything. She couldn't. The pauses had been the communication. Too long, too careful, placed exactly where someone would hesitate if they were aware that someone else in the room was listening to every word. "He's still in there, and she knows she can't say so." The security guard had his radio up. "Police ETA is 5 minutes." 5 minutes was manageable if nothing changed. 5 minutes became a problem the moment the man in room 31 figured out that the hospital's 3rd floor had gone quiet in a specific way. The absence of the routine sounds that a pediatric wing generated, the footsteps and cartwheels and distant crying, all the ambient noise that had stopped when the lockdown started and the staff had been told to stay at the station. He would notice the quiet. People trained for this kind of work noticed the quiet before they noticed almost anything else. She needed to create noise. "I need a medication cart," she said to Patricia. "Running, down this hallway. Now." Patricia stared at her for half a second, then understood and turned to the nearest nurse. "Kowalski. Cart. Move it." The nurse, a young man who looked like he'd been awake for longer than his shift explained, grabbed the nearest medication cart and started pushing it down the corridor with the routine, unhurried sound of hospital equipment in motion. Patricia walked beside it, asking him something about a patient in room 28 in a voice pitched to Carrie. Evelyn moved to the wall beside room 31's door. The ambient sound returned to something approximating normal. Not perfect. The absence of other patients in the hallway was still a gap, but enough to buy minutes. She pressed her back against the wall and thought about the room on the other side of the door, the layout. the sight lines from the entry, where a person would position themselves if they were managing two civilians they didn't want to hurt but were using as insurance. Near the window, probably. Back to the exterior wall facing the door. The woman and child on the bed, between him and anyone who came in. She heard footsteps on the stairs. Calloway came through the stairwell door with Beckett and a third person she hadn't seen before. A woman in civilian clothes who moved like the other two and was carrying a bag that was not a medical bag. They reached her without speaking. Calloway looked at the door, then at Evelyn. "What do we know?" She told him in under a minute. Room layout, sight lines, the phone call, the woman's pauses. He listened without interrupting. When she finished, he looked at Beckett. "Window access from the courtyard?" "Third floor. Possible, but it takes time we might not have." Calloway looked back at the door. The calculation was visible on his face. The same calculation she'd run, the one that weighed the risk of action against the risk of waiting and arrived at the uncomfortable answer that both options had significant costs. "The woman on the phone," he said to Evelyn. "She was stable, not in immediate distress. She was managed. There's a difference." "I know there's a difference." His voice wasn't sharp. It was the voice of someone who needed accuracy more than he needed reassurance. "What's your read on his timeline?" "He's waiting. He was supposed to go out through the loading dock with the other two. That didn't happen. He doesn't know why yet. He's waiting for a signal that isn't coming, and at some point he's going to figure out that the signal isn't coming because the other two are in custody." She paused. "When he figures that out, he stops waiting." Calloway looked at her for a moment. "How do you know they were supposed to go out through the loading dock?" She hadn't explicitly told him that. She'd inferred it from the layout and the trajectory of the first two men, and she'd said it now without thinking about whether it would raise questions. "Building geography," she said. "Only logical exit given their entry point and the file location." He held her gaze for 2 seconds longer than was strictly necessary for the purpose of processing what she'd said. Then he turned back to the door. "We go in," he said to Beckett. "Standard entry. I take the threshold, you take the room." He glanced at the civilian woman with the bag. "Torres, stay with the nurse." "No," Evelyn said. Everyone looked at her. "If you breach that door, the first thing he does is put his hands on the child. That's not a guess. That's physics. He's behind them. The door opens. His hands go to the closest civilian body because it's the fastest way to reset the power dynamic." She kept her voice level. "You need someone he doesn't immediately read as a threat to go in first." Calloway's expression didn't change. "That's not something I can authorize a civilian to do." "I'm not asking you to authorize it. I'm telling you what the tactical reality is." She met his eyes. "He's been in there with a woman and a 7-year-old for almost 15 minutes. He doesn't know what's happening outside that room. If a nurse walks in with a medication tray, she's not a threat. She's the environment. She's furniture. He has to make a decision about whether to stop her, and every second he's making that decision is a second he's not moving on the child." The hallway was quiet. The medication cart had reached the far end and turned around. Calloway looked at her with the expression she'd now seen twice, the one that was trying to locate her in a taxonomy of people he'd encountered before and not succeeding. "You know what you're walking into," he said. It wasn't a question. "Yes. And you understand what I can and cannot do if it goes wrong in there." "Yes." A pause. "If he makes a move, you get to the floor. You don't try to manage it. You drop, and we come through the door." "Understood." Torres opened the bag and produced a lightweight ballistic vest. Evelyn put it on under her scrub top, which added bulk that would have to pass as a heavier uniform layer. Torres handed her a medication tray, real supplies, pulled from the cart, because the tray needed to be real and the weight needed to be consistent. A sealed medication cup, a fresh BP cuff, a small basin. She picked it up. Her shoulder ached. She noted it and let it go. She knocked on the door to room 31. "Medication check," she said. The voice she used was the voice she used 50 times a day. Not flat, not artificially bright, just the functional friendliness of someone doing a routine task. She opened the door without waiting for a response, because that was how nurses entered rooms, with a knock that was courtesy, not a question. and she came through it with the tray at waist height and her eyes going first to the child. The boy was in the bed, small, dark-haired, watching her with the open attention of a 7-year-old who had been still for a long time and was interested in anything that wasn't the ceiling. His color was better than she'd have expected for an active respiratory infection. Slightly flushed, breathing a little fast, but alert. An oxygen saturation monitor clipped his index finger. His mother sat in the chair beside the bed, and the angle of her body was wrong, too upright, too still. The posture of someone who had been told not to move. The man was by the window, not behind them, as she'd predicted, but off to the side, positioned where he could see the door and the bed simultaneously, which was smarter than she'd given him credit for and meant her entry angle was more exposed than she'd wanted. He was in maintenance coveralls, average build. His right hand was in his pocket. She didn't look at his right hand. She looked at the BP cuff on the tray. "Hi there," she said to the boy. Not to the mother, not to the man, to the boy, because that was what a nurse did. "I'm Evelyn. I just need to check a couple of things really quick, okay? You're not going to feel anything." "Okay," the boy said. She moved to the bed. She felt the man by the window track her movement and make the calculation she'd predicted. Not a threat, task-oriented, routine. And not move to stop her, because stopping her required action, and action created noise, and noise was the thing he was managing against. She set the tray on the overbed table. She unrolled the BP cuff. She looked at the mother, whose name was Daniela, according to the chart, Daniela Navarro, 34 years old, 2 emergency contacts listed, and made eye contact for exactly the right duration. Not too long. Not the eye contact of communication, the eye contact of routine assessment. Daniela Navarro was holding herself together with everything she had. Evelyn could see it in the fine tension around her mouth, the way her hands were pressed flat on her thighs. She was a woman who had been frightened into a very specific kind of stillness, and she was maintaining it because her son was in the bed 3 feet away, and the man by the window had made clear what would happen if she stopped. Evelyn wrapped the BP cuff around the boy's arm. He watched the process with the curious detachment of children experiencing medical equipment, which she found, in this particular moment, unexpectedly steadying. "Can you make a fist for me?" she said. He made a fist. She inflated the cuff. The machine read 96/58, slightly low for a child his age, which tracked with an acute infection and reduced fluid intake. "Good job," she said. "How's your breathing feeling? Better than this morning?" "A little," he said. She checked his sat monitor. 94%. Acceptable. She made a note on the tray's paper strip, the way she would in any room on any other afternoon. And she did not look at the man by the window again because looking at him would confirm his relevance to her, and his relevance to her would confirm the scenario he was operating in. And right now what she needed him to believe was that she was not operating in any scenario at all. "Mrs. Navarro," she said, turning to the mother. "Have you had anything to eat in the last few hours?" Daniela blinked. "What?" "We have a family lounge on this floor. There's coffee and—" "She's fine," the man by the window said. It was the first time he'd spoken. His voice was flat, controlled, with the particular quality of someone managing their own tension through compression rather than release. Evelyn turned to look at him the way she would look at any visitor who'd offered an opinion on a patient's care. Present, but not alarmed, slightly confused about the relevance of his input. "I was speaking with the patient's family member," she said. The mildest possible correction, delivered in the mildest possible tone. His jaw tightened. His right hand shifted in his pocket. She looked back at the boy. "I'm going to listen to your lungs really quick. Can you sit up for me?" She was reaching for the stethoscope on the tray when her phone buzzed in her pocket. She had silenced the ringer. The buzz was the signal she'd set up with Callaway. 1 buzz, 30-second warning. She kept her hand moving toward the stethoscope. She did not accelerate, did not change her breathing pattern, did not do any of the things the body wanted to do when a countdown started. The boy sat up. She put the stethoscope in her ears. She placed the diaphragm on his back. "Big breath in," she said. He breathed in. She listened. The bases were slightly diminished on the left, consistent with the consolidation pattern she'd expect from his presentation. She would note that for the attending later. The clinical observation happened automatically, below the level of whatever else she was tracking, because it was her job, and her job did not stop because the context around it had become dangerous. Good, she said. One more. 15 seconds. Perfect. She wrapped the stethoscope and stepped back from the bed. She picked up the tray. She turned toward the door. Wait, the man said. She stopped, turned back. The expression on her face was the expression of someone who has been interrupted while doing a mundane task and is professionally obligated not to show irritation about it. Leave the tray, he said. She looked at the tray, then at him. I need to return this to... Leave it. She set it on the overbed table. Her hands were steady. The tray was not a weapon and she was not planning to use it as one, but putting it down meant he had made a decision that moved him from passively allowing her presence to actively directing her actions, and that shift meant his confidence had just dropped. She looked at the door. She looked at Daniela Navarro. Mrs. Navarro, she said, and her voice came out perfectly level. I need you to take your son and move to the bathroom. Daniela stared at her. The man by the window moved. She was already dropping. The door came open behind her. She heard it rather than saw it, the specific sound of a fire door thrown wide. And then the room became loud and brief and terrible, the way these things always were, stripped of any of the shape that aftermath gave them. She was on the floor with her cheek against the linoleum, and she could hear Daniela Navarro pulling her son off the bed. She heard the monitor alarm as the SAT clip disconnected. And she heard Calloway's voice once, very clear, saying down, down, on the floor now. And she heard the impact of a person hitting the wall with significant force. And then for approximately 4 seconds, there was nothing but controlled breathing and the distant sound of the SAT monitor, alarming without purpose because the child was no longer attached to it. Then quiet. Evelyn pushed herself up to her hands and knees. The vest had taken the impact of the floor better than her shoulder had, which meant the shoulder was now a problem she was going to need to deal with. She stood. Daniela Navarro was in the corner of the room with her son against her chest, both of them on the floor, the boy's face pressed into his mother's neck. He wasn't crying. He was making the high, thin sound of a child who has exceeded the capacity of tears. The man from the window was on the floor under Calloway's knee, and whatever he'd had in his pocket was no longer in his pocket. Beckett was at the door. Torres was moving toward the Navarros. Evelyn crossed the room and crouched in front of Daniela. He's okay, she said. Look at me. He's okay. Daniela looked up. Her eyes were the eyes of someone who had been holding a catastrophe at bay through sheer will and had just been handed permission to release it, and the release was not clean or composed. It was the ugly, involuntary collapse of someone whose body was no longer willing to cooperate with their intentions. He's okay, Evelyn said again. She reached out and put her hand on the boy's back, felt his breathing, rapid but not labored, the breath moving in and out in the ragged way of a child mid-crisis, and she stayed there until she felt it begin to slow. What's his name? Marco, Daniela managed. Marco. She kept her hand on his back. He's safe. I've got him. The boy peeled his face away from his mother's neck and looked at Evelyn. His eyes were the reddened, slightly unfocused eyes of a child who had pushed through something he didn't have the vocabulary for. He looked at her for a long moment. Are you the nurse? He said. Yeah, she said. I'm the nurse. He wouldn't let us leave. I know. He's not going to do that anymore. Marco considered this with the odd, direct gravity that children sometimes brought to facts that adults would wrap in several layers of processing before accepting. Then he nodded, as though something had been confirmed. Evelyn stood. Calloway was upright now, the man on the floor secured. Beckett was on his radio. Torres was crouching with the Navarros, getting between them and the door in the instinctive way of protective detail work. Calloway looked at Evelyn. His expression had changed. Not dramatically. He wasn't a dramatic person. She'd gathered that much. But something in it had shifted in a way she recognized as significant, even though she couldn't have said precisely what had shifted. You dropped when I said to, he said. You told me to drop. Some people don't. She looked at the man on the floor, then back at Calloway. What happens to him now? He'll be in federal custody within the hour, along with the other two. He paused. We're going to need a statement from you about everything that happened in this building today. All of it. She nodded. I also, he said, measuring his words carefully, am going to need to know who you are. There it was. She'd been waiting for it since the stairwell, when he'd caught the inference about the loading dock. She'd been managing it the way she managed most things. Not by avoiding it, but by deferring it until the more immediate problem was resolved. The more immediate problem was resolved. She looked toward the window. Through the glass, the late afternoon light had the long amber quality of a Colorado winter afternoon giving way to evening. The mountains going purple at the ridgeline, the rail yard beyond the hospital's north perimeter showing rust and shadow. My name is Evelyn Marsh, she said. I'm a nurse on the East Wing. She paused. Before that, I was a U.S. Army combat medic attached to a special operations support element. 2 tours in active theater, 14 months with a forward surgical team that spent most of its time in places that don't appear on briefing slides. She didn't look away from the window. I left the service 3 years ago. Honorable discharge. I took a civilian nursing license, and I took a contract in New Mexico, and then I took a position here. I wasn't hiding. She finally looked at him. I just stopped talking about it. Calloway was quiet for a moment. Special operations support. Which element? The kind where the answer to that question is not part of the civilian record. He looked at her steadily. Then, with the quality of someone making a decision that had more than one component, he nodded. All right, she said. From down the corridor came the sound of footsteps. Multiple, quick, the specific rhythm of people arriving with authority. Local police, finally. She heard radio chatter, a voice giving a room number. Calloway turned toward the door. I'm going to need you to stay in the building, he said. Don't go far. I have patience, she said. I'll be on the East Wing. He almost smiled. She caught the edge of it before it resolved into whatever more controlled expression he'd intended. He turned away and moved toward the corridor. Evelyn looked at the boy one more time. Marco Navarro was sitting now, his mother's arms still around him, his oxygen saturation monitor back on his finger courtesy of Torres, who had the calm competence of someone used to managing the periphery of difficult situations. His SAT had come back to 93. His breathing was slower. He met her eyes. Are you going to be here tomorrow? He asked. She thought about that. Tomorrow was a genuine unknown in more ways than she had energy to enumerate at this particular moment. I'll check on you in the morning, she said. She picked up the medication tray from the overbed table. Because it was hers and it belonged back at the station, and leaving equipment in patient rooms was a documentation issue. And she walked out of room 31 into the pediatric wing corridor. The police were at the far end. Calloway was speaking to a sergeant. Breckett had the third man upright and moving toward the stairwell. The pediatric nursing staff had come out of the lockdown cluster and were beginning the quiet practice process of restoring normalcy to a wing that had a 7-year-old with a respiratory infection and several other children who had probably heard things they weren't going to understand until they were old enough to ask different questions. Patricia appeared from the direction of the stairwell. She stopped when she saw Evelyn. She looked at the medication tray. She looked at the slight additional bulk under Evelyn's scrub top. She looked at Evelyn's face, which Evelyn kept professionally neutral, and the bruise that was now visible at the edge of her collar where the wall contact in the stairwell had bloomed up toward the neckline. You went in that room, Patricia said. I checked on a patient. Evelyn. She shifted the tray. He's in custody. The mother and son are okay. I need to get this equipment back downstairs, and then I need to check on Mrs. Delacroix in room 9. Because her BP medication situation still hasn't been resolved. Patricia stared at her. You went into a room with an armed man and a hostage, and you did it with a medication tray and a blood pressure cuff. The vest helped. Patricia stopped, looked at the scrub top. Is that borrowed? I'll return it. Evelyn started down the corridor. When Dr. Holt comes back for his afternoon rounds, can you make sure the access log from this morning is printed and attached to my file? I want the timestamp on record. She was halfway to the stairwell when she heard it. Not from behind her, not from the floor she was standing on, but from below carried up through the building in the way sound moved through old hospital structures. A voice on a radio, words she couldn't make out. Then another voice, sharper, with the quality of someone receiving information that required immediate action. And then, very clearly, through the stairwell door she was just about to push open. Admiral's on the ground. ETA to the building is 4 minutes. He's not coming through normal channels. She pushed through the door and started down the stairs, and her mind was already running the calculation she didn't want to run, because an admiral arriving personally, not through channels, not with advanced coordination, meant the situation had escalated above anything she'd been managing today. And whatever was coming through that hospital entrance in 4 minutes was going to require answers she had been successfully not providing for 3 years. Halfway down the second flight, her phone buzzed. Not Calloway this time. Not Patricia. The number on the screen was one she hadn't seen in 3 years, attached to a name she hadn't spoken aloud since the day she signed her discharge paperwork. She stopped on the landing. She looked at the name for 2 full seconds. Then she answered it. "Marsh," said the voice on the phone. She knew the voice. She had last heard it on a tarmac in a country she wasn't going to name on a stairwell landing in a Colorado hospital 3 years and 4 months ago, when the man it belonged to had told her the extraction was clean and her service record would reflect accordingly and that she should get some sleep. "Vasquez," she said, "I'm in the building." A pause. "Don't hang up." She hadn't been planning to. "You're with the Admiral." "I'm ahead of the Admiral. He's 2 minutes out. I came in through the loading dock." Another pause, shorter. "I know about the loading dock because I know about the team he sent. Past tense. Sent. I've been tracking this operation for 6 weeks. She processed that in the specific way she processed information that had more than one implication layered inside it. 6 weeks. The contractor network behind the Holloway testimony, we knew they were going to move on her. We didn't know when or where. His voice had the careful flatness of someone delivering information they'd been sitting on long enough to feel the weight of it. "We picked up the hospital plan 48 hours ago. I was already on a plane." "You didn't warn her." "We didn't have confirmation of the specific location until—" "You didn't warn her," Evelyn said again. Not accusatory, just the fact, placed where it needed to be placed. A silence that had some honesty in it. "No, we didn't." She started moving down the stairs again, phone at her ear. The file they were photographing, Sylvia Holloway's procurement records. "We have the phones. The images didn't transmit. They were working on a closed protocol that required a relay device they didn't get to use." He paused. "That's because you pulled them out of the mechanical room before they could establish the relay." "I didn't pull them out. Calloway's team did." "After you found them." She came out on the ground floor and moved through the connecting hallway toward the ED. "What do you need from me, Vasquez?" "Right now, stay visible. The Admiral is going to want to see you, and I need you in the room when he does, because there are people in this hospital's administration who are going to try to manage the narrative of what happened here today before the federal review starts." She stopped walking. "Which people?" "That's what I need to confirm. We have a secondary problem." His voice shifted in a way that told her the next part was the part he'd been building toward. "The team that came into this hospital today, the 3 men, they didn't plan this operation from outside the building. The maintenance corridor access, the camera at the East Wing junction, the specific room assignments for the pediatric wing today. That information came from inside Harlow Memorial. She had known this. She had known it since the camera went dark, and the men moved through service corridors that weren't on any public record. She had filed it as a known unknown and moved past it because the immediate problems were more immediate. "Someone on staff," she said. "Someone with administrative access, facility maps, patient placement records, security camera login credentials." He paused. "We have a short list. I need someone who has been in this building for the last 11 months to tell me if any of these names are wrong." She was already thinking through the day. The camera. The access logs. The way the charting error had appeared in her file with her badge number attached to a timestamp when she wasn't in the building. The specific phrasing Holt had used. "I've been watching her since she transferred in." And the fact that Holt had known about the documentation issue before the charge nurse had formally flagged it, which meant he'd been checking her record directly and recently. "Vasquez," she said, "read me the list." The main lobby of Harlow Memorial had the quality of a space that was trying to return to normal and not quite managing it. The police presence was visible, 2 uniforms near the security desk, another at the main entrance, and the staff moving through the space had the slightly altered gait of people who had been told something was over, but whose bodies hadn't fully accepted the information. Evelyn came through the lobby at 3:47 p.m. and found Colonel Calloway standing near the information desk with 2 people she hadn't seen before, a man in a dark suit with the particular stillness of federal law enforcement and a woman in a military uniform carrying a tablet. They were looking at something on the tablet together, and the conversation was quiet and pointed. She had 4 minutes before the Admiral's arrival, according to Vasquez's timeline, and she used 2 of them to find Patricia. Patricia was at the lobby's east edge, standing with the hospital's chief nursing officer, a woman named Greta Wills, who ran nursing operations with administrative precision and had the quality of someone who managed crises primarily by generating documentation. Wills was speaking. Patricia was listening with the expression of someone who disagreed with everything being said, but was choosing her moment. Evelyn came up beside Patricia and said, quietly, "I need 5 minutes with you before the Admiral comes in." Wills stopped speaking. She looked at Evelyn with the assessing quality of someone encountering a variable they hadn't accounted for. "You're the East Wing nurse, Marsh?" "Yes." "I've been trying to get a picture of what happened on this floor today. I understand you were involved in—" "I was doing my job," Evelyn said. Not rudely, clearly. "I'll give a full statement to the Federal Review. Right now I need to speak with my charge nurse." Wills blinked. The sentence had been delivered with a quality of authority that didn't match the scrubs and the lanyard and the general visual presentation of a floor nurse, and the mismatch was doing something to Wills's ability to respond in the way she'd intended. Patricia stepped away from Wills without waiting for permission. They moved toward the corridor that led to the cafeteria, which was empty at this hour. "Vasquez," Evelyn said. "The name. Is it familiar?" "Marcus Vasquez? He called you?" "He's with military intelligence. He's been tracking the contractor operation for 6 weeks." She paused. "He gave me a list of names, people with the access profile that matches what the team used to get into the building. Camera credentials, facility maps, patient placement." Patricia was very still. "How many names?" "4. 3 of them I don't know well enough to read. The 4th one I know." She looked at Patricia directly. "I need to know if I'm wrong." Patricia's jaw tightened. "Tell me." "The charting error this morning. My badge number on an entry at 6 a.m. when I wasn't in the building. Someone created that entry. It required access to the nursing documentation system with my credentials, which means either my credentials were compromised or the person who created it had administrative override access." She kept her voice even. "Dr. Holt told me he'd been watching my documentation since I transferred in. He knew about the error before the charge log was filed. He had to have been in the system directly to know that." Patricia was quiet for a moment. That was longer than comfortable. "There's something else," she said. Her voice had changed. "Last week, Holt asked me for the patient placement schedule for the pediatric wing. He said he was cross-referencing for a staffing proposal. Did that strike you as unusual?" "At the time, no. He's attending. He asks for things." She paused. "Now it strikes me as very unusual." "He had the room assignment for Marco Navarro." "Yes," Patricia said. "He would have." Evelyn looked toward the lobby. Through the glass partition, she could see movement near the main entrance. A shift in the security posture of the people near the door. A straightening, a reorientation of attention toward the outside. "The Admiral's here," she said. Admiral Nathan Holloway was a large man in his early 60s with close-cropped gray hair and the kind of face that had been shaped by weather and decision-making in roughly equal measure. He came through the main entrance with 2 aides and a personal security detail of 4, and the quality of his arrival was different from Calloway's arrival. Calloway had come in like someone trained to minimize their signature. Holloway came in like someone who had spent 40 years being the person everyone else organized themselves around, and had made a certain peace with that. He went directly to Calloway. They spoke for less than a minute. Then Calloway turned and found Evelyn across the lobby, and the look he gave her was the look of someone indicating a direction without pointing. She crossed the lobby. Holloway turned to face her. His eyes moved over her with the practiced speed of someone accustomed to rapid assessment, and what they found seemed to require a brief recalibration. The scrubs, the bruise at her collar, the vest that was still creating visible bulk under her top because she hadn't had a moment to return it. "Ms. Marsh," he said, "Admiral, my sister is alive because of what you did today." He said it directly, without the emotional freight that the words might have carried from someone less practiced at receiving and delivering significant information. It wasn't cold. It was the warmth of someone who had trained themselves not to leak sentiment in professional contexts and was working within that constraint. "I've been briefed on the timeline. I want to hear it from you directly. There will be a federal review." "I know there will be a review. I want to hear it from you," she told him. Not everything. Not Vasquez. Not the phone call on the stairwell landing, because those were threads that were still live, and she wasn't going to pull them in a lobby. But the sequence of events from the moment she'd heard the footsteps that didn't match the building. The camera. The two men. The file in the mechanical room. The pediatric wing, room 31, Marco Navarro and his mother. Holloway listened without interrupting. It was the listening of someone who had been in rooms where the quality of information determined outcomes, and who had learned that the worst thing you could do while receiving a report was insert yourself into it. When she finished, he was quiet for a moment. Then, "You were a combat medic." "Yes." "Special operations support." "Yes." "That's not a standard assignment for a nurse." "No," she said. "It's not." He looked at her with the directness of someone asking a question without asking it. She answered the question he wasn't asking. "I was good at staying calm in situations that produce poor decision-making in most people," she said. "That turned out to be useful in certain contexts." "It turned out to be useful today," he said. She didn't answer. She looked past him toward the corridor, where she could see the man in the dark suit from earlier moving with a new quality of purpose. Phone at his ear, hand going up to stop someone in the corridor. She tracked the trajectory and found the person being stopped. Dr. Gordon Holt. In his coat, badge on, moving toward the lobby with the particular stride of someone who had heard the Admiral was in the building and had decided to be visible. She looked back at Holloway. "Admiral," she said, "there's something that needs to happen in the next few minutes, and I need you to let it happen without intervening." He followed her eyeline to the corridor, then back to her. "Explain." "The man being detained by your colleague in the corridor is the department attending who filed a false documentation complaint against me this morning. He also, we believe, provided the operational team with facility access credentials, camera override codes, maintenance corridor maps, patient placement records for the pediatric wing." She kept her voice level. His access to that information was legitimate by virtue of his position. His use of it was not. Holloway's expression did something complex and brief. "You're telling me someone on this hospital's medical staff facilitated an assassination attempt on my sister. I'm telling you the evidence points in that direction, and the federal review will confirm it or not." She paused. "What I'm asking is that you let the review process work. If you intervene right now, his attorney has a contamination argument." He looked at her for a moment with the expression of a man who was accustomed to being the one who decided when and whether to intervene, and who was being asked to exercise restraint by a nurse in borrowed body armor with a bruise on her collarbone. "All right," he said. In the corridor, the man in the dark suit had his credentials out. Holt was reading them. She watched Holt's face change. The particular sequence of expressions that moved from confident indignation through confusion to something that looked from 40 feet away like the first moment a person understands that the ground they thought was solid is not. He said something. The man in the suit said something back. A second person appeared from the direction of the security desk. A woman in a jacket who had the bearing of a federal agent and had apparently been in the building since before the Admiral arrived, stationed and waiting. Holt looked up from the credentials. His eyes moved across the lobby and found Evelyn, and what she saw in that look was not guilt exactly. Guilt required more self-awareness than was available to someone in the middle of having their world restructure itself. but a kind of arrested recognition, the look of someone identifying a variable they had profoundly miscalculated. He had looked at her this morning and seen a documentation problem. A nurse with a suspicious record, a person of limited consequence who could be managed and observed and quietly maneuvered out of a position she didn't deserve. He was still looking at her when the woman in the jacket touched his arm and said something that made him look back at her and stop looking at anything else. The next hour moved in the way that hours moved after high-pressure situations resolved. Not smoothly, not cleanly, but in the lurching, overlapping rhythm of multiple processes running simultaneously without coordination. Federal agents in the ED, where Sylvia Holloway had been moved again, this time to a private room on the second floor with actual protective detail at the door. Police finishing their sweep of the maintenance corridors. Hospital administration in the conference room off the main lobby, where Greta Wills was apparently generating documentation at a rate that suggested she was trying to create paper record of institutional competence retroactively. Evelyn gave her statement to a federal investigator named Pruitt in a small room near the security office. Pruitt was methodical and thorough and asked several questions twice, from different angles, in the manner of someone checking for consistency. She was consistent. She had nothing to be inconsistent about. Vasquez appeared when Pruitt left. He came in and closed the door and sat across from her and looked like 3 years of intelligence work rather than the man she'd last seen on a tarmac. His hair was shorter. The scar above his left eyebrow that she'd watched a field medic close with steri strips was now just a line of slightly different colored skin. "Holt," he said. "Yes." "He's been under financial pressure for 2 years. The contracting network recruited him 8 months ago. His access profile was exactly what they needed: medical facility administration, patient records, security integration." He paused. "He didn't know what the access was for. That's what he's going to say." "Is it true?" Vasquez considered the question with more care than a simple yes or no would have required. He knew it wasn't legitimate. Whether he knew a woman was going to get shot is a separate question. He leaned forward slightly. His lawyer is going to make that separation his entire defense. That's for a court to work out. "Yes." He paused again. "He filed a false complaint against you this morning. He entered a charting error under my credentials, which I assume required the same access he used for the camera override. Same system, administrative credential layer." Vasquez's voice had a flat quality she recognized, the tone of someone delivering information that had a secondary meaning they were leaving for you to find. "The complaint would have gone into your disciplinary file. 3 complaints in a calendar year triggers an automatic license review in Colorado." She looked at him. "How many complaints are in my file right now?" "As of this morning, before we pulled the records?" 2. He watched her face. "The first one was from 6 months ago. Different attending, different ward, a medication timing discrepancy that the other nurse on duty said she didn't see and the patient didn't corroborate." She thought about that. 6 months ago. Not long after she'd been involved in a situation, a patient who'd come in post-assault, a family member who'd been behaving in ways that warranted a social services call, a complaint that had gone upward through channels and made someone uncomfortable. She'd thought the complaint was professional retaliation from the family. "He built the file," she said. "Someone did. The first complaint may not have been Holt. We're still tracing the access, but the pattern was being constructed." Vasquez sat back. "Someone wanted a paper trail that would make your removal from this hospital look procedurally legitimate." She sat with that for a moment. Not the anger. The anger was there. She wasn't going to pretend it wasn't, but it was the manageable kind, the kind that didn't cloud processing, but the specific shape of what it meant. Someone had looked at her and identified her as a risk, not because of what she'd done, but because of what she might do, what she might see, what she might recognize. "They knew who I was," she said. "We think they ran background on all clinical staff when they started planning the operation. Your military record is sealed, but the gap in your employment history before the New Mexico contract is visible if you're looking for it." He paused. "A combat medic with special operations attachment who takes a floor nursing job in a regional hospital. If you're a contractor trying to run an operation through that hospital, that's a flag. So they tried to remove me before the operation. Yes. He looked at her steadily. And it didn't work. And then the operation ran anyway, and you were still in the building, and the rest of it followed from there. She looked at the wall. The small room had a clock on it, the analog kind, institutional, with a slightly loose second hand that stuttered at the 12. It was 5:22 p.m. She had been on shift since 7 this morning. Sylvia Holloway, she said. The surgery. Vasquez stood. That's already in motion. There's a thoracic surgeon coming in. The hospital's OR is being prepped now. Dr. Ferris is consulting. He moved toward the door. She asked about you. Tell her I'll come by when she's out of recovery. He put his hand on the door, stopped, turned back. Marsh, he said, for what it's worth, the way you managed this building today, the way you read it, move through it, made decisions without a single asset, no comms, no support, no gear. He stopped. You haven't lost anything. She looked at him. I wasn't trying to find it. He nodded once, then he left. She sat in the small room for 2 more minutes. The clock's second hand stuttered at the 12 and moved on and stuttered again. She pressed 2 fingers against the bruise at her collarbone. Not hard, just enough to feel its boundary, the way you checked a problem to understand its dimensions. Then she stood up and went back to the East Wing, because she had patients and the East Wing was where she worked. Yeah, Patricia was at the nursing station. She had the particular look of someone who had been holding a floor together through an event that exceeded the floor's normal parameters and was not yet ready to stop holding it together, even though the immediate threat had passed. Room 14, she said when she saw Evelyn. Robert Okafor. Surgical consult finally came up. They're recommending intervention tomorrow morning. Good. Did the family gulp? The family actually talked to each other. His daughter called me to say thank you, which has never happened in my career. Patricia's voice had a slight roughness in it that she covered by looking at the board. Mrs. Delacroix in room 9. Her BP medication. The access log confirmed your badge wasn't in the building at 6 a.m. I sent the documentation to Wills and CC'd the federal investigator. Thank you. Holt's credentials have been suspended pending investigation. The medical board was notified 20 minutes ago. She paused. The board is going to open a review. Evelyn nodded. That's the right process. Is that all you have to say about it? She thought about what else she had to say about it. She thought about the charting error and the first complaint 6 months ago, and the specific weariness of being in a place where the people with authority used it to make the path smaller for the people without it, and the longer weariness of knowing that the correct response to that was not to stop doing the work. Right now, she said, I have 5 patients who need evening assessments and a BP issue in room 9 that needs to be resolved before day shift ends. Everything else is the review process's problem. Patricia looked at her for a long moment, not with the confusion of earlier, but with something that had more clarity in it and more respect, and also the slight quality of someone recalibrating a relationship they thought they'd already understood. The federal investigator wants to speak with you again tomorrow, she said. 8 a.m. I'll be here at 7:45. She was pulling up the patient list when the elevator at the end of the corridor opened and Colonel Calloway stepped out. He was not alone. One of Holloway's aides was with him, and the aide was carrying a folder. But Calloway came toward her directly, and the aide stayed at the elevator. I have about 4 minutes, Calloway said, before the Admiral wants to brief his sister's surgical team, and I need to be present. Okay. He looked at her with the direct, calibrated quality she'd come to expect from him. I made some calls this afternoon. While everything else was happening, I made some calls. She waited. Your service record, he said. The parts that are accessible. They're not very accessible. No, but I have clearances that open some doors. He paused. 14 months with the 43rd Forward Surgical, Kandahar, then the Paktika rotation. 2 commendations that aren't in any public record. A recommendation for the Surgeon General's Exemplary Service Medal that was blocked at the command level because the operation it was attached to doesn't officially exist. She looked at the patient board. That's an accurate summary. Why did you leave? She considered the question. Not whether to answer it. She was going to answer it. But How to answer it in a way that was honest without being more than what the moment required. I was good at the work, she said, and I was tired in a way the work was making worse. And I thought that being a nurse in a place that wasn't a combat zone would be quieter. She paused. It's mostly quieter. Calloway almost smiled again. The hospital board is meeting tomorrow morning, he said, before your 8 o'clock. The Admiral is going to speak to them. He held her eyes. There are going to be some questions about the security failures that allowed today's operation to proceed as far as it did. And there are going to be some questions about the staff member who enabled those failures. And there are going to be questions about what the appropriate institutional response looks like. She understood what he was saying underneath what he was saying. I don't need the board to do anything for me. I know you don't. He reached into his jacket and produced a card, plain, official, a government seal, and a phone number. This is not a job offer. This is a contact number for a consultation program that advises civilian medical facilities on emergency preparedness and tactical threat response. It's federally coordinated. They're always looking for people who understand both sides of that equation. He set the card on the nursing station counter. In case the East Wing ever stops being where you want to be. She looked at the card. She didn't pick it up. Right now, she said, the East Wing is where I need to be. He nodded. He went back to the elevator. She picked up the patient list. She was doing Robert Okafor's evening assessment. Room 14, surgical consult confirmed, family dynamics improved, documentation current, when her phone buzzed one more time. She checked it. A text from a number she didn't recognize. 14 digits, which was not a standard domestic format. The text contained 4 words and a file attachment. You should see this. She opened the attachment. It was a document, a procurement record, the kind Sylvia Holloway had been carrying, the kind the men in the mechanical room had been photographing. But this one was different. This one had names she didn't recognize from anything Vasquez had told her. Names attached to transactions that predated the Holloway testimony by 2 years. Names that, based on the organizational structure visible in the document's header, belonged not to the contracting network the federal investigation was currently pursuing, but to the people who had funded it. One of those names was on the hospital board, not a staff member, not an administrator, a board member, one of 7 people who governed Harlow Memorial, who would be sitting in a meeting tomorrow morning when Admiral Holloway addressed the institution about its security failures, who would be nodding and asking appropriate questions and offering appropriate concerns while carrying the specific knowledge that the operation which had failed today had been partly financed through a shell company that ran through his personal investment portfolio. Evelyn read the document twice. Then she called Vasquez. He picked up on the first ring. I just got something, she said. I know, he said. I sent it. She was quiet for a second. Why? Because the board meeting is at 7 a.m. tomorrow, and the person whose name is on page 3 is going to be in that room. A pause. And I needed someone in that building who would know what to do with the information before he had a chance to manage it. She looked at the document on her phone screen. Then she looked down the East Wing corridor, the rooms, the lights, the quiet functional reality of a place that had spent most of today being something other than what it was supposed to be. Vasquez, she said, what exactly are you asking me to do? The pause on the other end was not the pause of someone who didn't have an answer. It was the pause of someone who had an answer they knew was going to cost something. I need you to be in that room tomorrow morning, Vasquez said, not as a witness, as the person who hands the document to Calloway before Harlow gets a chance to control the conversation. She understood what that meant. It meant walking into a board meeting she had no institutional standing to attend, carrying evidence that implicated one of the 7 people running the institution she worked for, and doing it in front of an admiral and a federal colonel and a hospital administration that had spent most of today generating paperwork to protect itself. It meant being the person who pulled the thread publicly in a room full of people who would prefer the thread stayed where it was. What's his name? She said. Harlow. Douglas Harlow. He's been on the board for 11 years. His investment portfolio runs through 4 shell entities, 2 domestic, 2 routed through a holding company in the Caymans. The procurement network that funded the contracting operation pulled money through the second domestic entity starting 26 months ago. A pause. He doesn't know we have this document. He thinks it went up in smoke with the rest of the file. It didn't. Sylvia Holloway is more careful than the people trying to stop her gave her credit for. She kept a duplicate, digital, encrypted, sent to a secure server the night before she traveled. His voice had a quality she recognized, the specific satisfaction of someone whose subject had outmaneuvered people who'd underestimated her. It came through to our team at 4 this afternoon. Evelyn looked at the document on her phone one more time. Douglas Harlow's name appeared on page 3, attached to a transaction number, and a date and a dollar amount that had enough zeros in it to constitute a serious life decision. 7 a.m., she said. Conference room B, administrative wing. The Admiral's staff confirmed the location an hour ago. She put the phone in her pocket. She stood in the hallway of the East Wing for a moment, with the patient list still in her hand, and the evening assessment still waiting, and the clock on the wall reading 6:09 p.m., and she thought about what she was going to do with the next 13 hours. Then she went to check on Robert Okafor. He was watching his nature documentary when she knocked. The surgery consult paperwork was on his bedside table, and his daughter had fallen asleep in the chair in the corner with her coat pulled over her like a blanket, and his son had apparently gone to get food from somewhere because he wasn't in the room. Robert Okafor had the particular peace of a man whose family had finally stopped performing their concern at each other and collapsed into the exhausted quiet of people who actually loved someone and were scared. "How are you feeling?" she said. "Better than this morning." He glanced at the sleeping daughter, then back at Evelyn. He looked at the bruise at her collar. He looked at her eyes. He was 63 years old and he'd seen things, and what he saw in her face was apparently something he recognized. "Rough day?" "Moderate," she said. He almost smiled. "You don't have to check on me. I can see you're not doing great." "I'm fine." She pulled up his chart on the tablet. "Your vitals look stable. The surgical team is going to come by first thing in the morning to prep you." "I know." He was quiet for a moment. "My daughter told me what happened on this floor today, some of it. She heard from one of the other nurses." He looked at her directly. "She said a nurse talked a man down in the pediatric wing, kept a mother and child from getting hurt. The police handled it." "That's not what she said." She finished her chart entry. She capped the stylus and set the tablet down. "Get some rest. Big day tomorrow." "You too," he said. It wasn't a pleasantry. It was the voice of someone who had correctly assessed that the person leaving his room was going to need sleep more than they were likely to get it. She checked on 4 more patients. She updated 7 charts. She found the medication timing error in Mrs. Delacroix's record, traced it to its source in the administrative access log, documented it thoroughly, and sent the complete record to both Patricia and the federal investigator's office. She did all of this with the systematic focus of someone who understood that the work didn't pause because the context around it had become complicated, because the work was the point and had always been the point. At 8:47 p.m., she turned over her patients to the night shift nurse, a steady and competent man named Trevino, who had heard enough through the building's informal information network to look at her with more careful attention than he usually did. "I've got it from here," he said. "Room 14 has surgical prep in the morning. Make sure the pre-op orders are in by 6. She picked up her bag. "And room 9? "The BP medication documentation. I flagged it, but double-check the morning orders against the corrected record." "Got it." He paused. "Marsh, you okay?" "I'll be back at 7, she said, and went home. Her apartment was 6 blocks from the hospital. She'd furnished it practically. A bed, a kitchen table, 2 chairs, books organized by subject rather than author, a set of running shoes by the door. She had lived in it for 11 months, and it looked like she'd moved in 3 weeks ago, which was not intentional. It was just what happened when you didn't put pictures on walls because you hadn't decided yet if the walls were permanent. She ate something from the refrigerator that she wouldn't have been able to describe afterward. She showered. She sat at the kitchen table with the document still on her phone and read it twice more, slowly, building the architecture of what she was going to say in the morning and where she was going to say it and what would happen in the room when she said it. She slept for 4 hours. Not well, but enough. She was back at the hospital at 6:48 a.m. The administrative wing of Harlow Memorial had the particular aesthetic of institutional respectability: carpeted corridors, framed achievement citations, the quiet that came from proximity to people who spent their days making decisions rather than implementing them. Conference Room B was at the end of the main corridor, behind a glass partition through which, at 6:54 a.m., Evelyn could see a long table being arranged with water glasses and notepads and the particular theater of preparedness. Calloway was in the corridor. He'd been there, she suspected, for some time. He looked at her when she came off the elevator. She handed him her phone with the document open. He took it. He read it. He read it again. He looked up at her. "When did you get this?" "Last night, 7:15. "Vasquez." "Yes." He looked back at the document. The particular quality of his stillness was the stillness of someone incorporating information that changed the geometry of a situation they'd already been managing. She watched him do it. The rapid, disciplined processing of a man who had spent a career making consequential decisions on incomplete information. "Douglas Harlow," he said. Page 3. The transaction date is 26 months ago. The routing through the second domestic entity matches the procurement network's financial structure. Has anyone else seen this? Vasquez's team. Me. Now you. Calloway looked toward the conference room. Through the glass, she could see people beginning to arrive. Hospital administrators, the chief nursing officer, 2 people in suits she didn't recognize. And at the far end of the table, taking his seat with the comfortable authority of someone who had occupied this room many times, a heavy-set man in his 60s with silver hair and the well-maintained appearance of someone who had been prosperous for long enough that prosperity had become invisible to him. Douglas Harlow poured himself a glass of water and said something to the woman beside him that made her laugh briefly and professionally. "He doesn't know," Evelyn said. "No." Calloway looked at the document one more time. Then he made a decision that was visible in the specific way he straightened. "I need you in that room." "I have no standing to be in that room." "You're a witness to yesterday's events and a direct subject of the false documentation that was part of the operational cover. That gives you standing." He handed her phone back. "Send this document to the contact number on the card I gave you last night. Do it now. Encrypted attachment." She sent it. The confirmation came back in 40 seconds, which told her the contact number connected directly to someone who had been awake and waiting for it. At 7:02 a.m., Admiral Nathan Holloway came off the elevator with 2 aides and the quality of presence that reorganized the physical space around him. He saw Calloway. He saw Evelyn. He came toward them. "She's out of surgery," he said. To Evelyn, not to Calloway. "Dr. Ferris said it went as well as it could. She'll be in recovery for another few hours." "I'll check on her this morning," Evelyn said. He nodded. Then he looked at Calloway, and something passed between them in the compressed language of people who had worked together long enough to communicate in shorthand. Calloway tilted his phone screen toward the Admiral. Holloway read what was on it. His face did something brief and controlled. "He's in there now?" he said. "Seated at the far end," Calloway said. "He doesn't know about the Cayman routing. He thinks the domestic entities are clean. They're not." "No." Holloway looked at the conference room, then at Evelyn. "You found this." "The document was found by your sister. She preserved it. Vasquez's team confirmed the financial structure." She paused. "I just read it." "You did more than read it." He held her gaze for a moment that had more weight in it than most moments she'd spent in this building. "Are you ready to go in?" She thought about whether she was ready. She thought about 11 months of being watched and managed and quietly maneuvered. She thought about a charting error with her badge number on it and a complaint that had been constructed like a building, foundation first, designed to justify a conclusion that had been reached before any evidence was gathered. She thought about the supply room yesterday afternoon and the footsteps that didn't match the building and every decision she'd made from that moment forward, with no gear, no support, no authorization, and no one in this institution who believed she was anything other than what her badge said she was. "Yes," she said. The conference room went quiet when they walked in. Not all at once. The quiet moved through the room in a wave as each person registered the Admiral's presence and adjusted accordingly. Greta Wills, seated mid-table, straightened. The two suited figures Evelyn didn't recognize exchanged a glance. The hospital's legal counsel, a thin man named Garrett, who Evelyn knew only by reputation, put his pen down. Douglas Harlow looked up from his notepad and smiled the smile of someone accustomed to smiling at powerful people with the correct amount of deference. "Admiral, we're honored to have you here under these circumstances, though I wish—" "Thank you," Holloway said, and the two words were enough to close the sentence Harlow had been building. He sat at the head of the table. Calloway sat to his right. Evelyn sat beside Calloway, and the seating arrangement communicated something to the room that several people registered with visible uncertainty. Who was this person? Why was she at this table? What did her presence mean? Harlow looked at her. He didn't recognize her. She was a face in scrubs without context, and his eyes moved past her without catching. "I want to begin," Holloway said, "by establishing some facts about what happened in this building yesterday. Not the version that's been prepared for the institutional record, the actual sequence." He looked at the legal counsel. "Mr. Garrett, I'd suggest you take careful notes." What followed was 32 minutes of the Admiral laying out a timeline with the precision of someone who had been doing this kind of briefing for decades and had no patience for imprecision or omission. He covered the operational team's entry through the maintenance corridors. He covered the fraudulent federal credentials. He covered the pediatric wing in room 31 and the 3 individuals now in federal custody. He covered the false documentation in the nursing record that had been designed to remove a specific staff member from the building before the operation ran. He did not, in those 32 minutes, mention Douglas Harlow's name. Harlow listened with the careful, concerned expression of a board member receiving alarming information about an institution he governed. He asked 2 questions, both appropriate, both the kind of question designed to demonstrate engaged oversight rather than extract information. He shook his head at the right moments. He used the word accountability twice. Evelyn watched him and thought about the specific architecture of a person who had made choices they'd successfully separated themselves from in their own mind. Harlow hadn't been in the mechanical room. He hadn't been in a hospital corridor with a fraudulent credential. He'd signed documents and moved money through structures designed to make the movement invisible, and told himself that what happened downstream of those structures was someone else's operational problem. She'd seen that architecture before, in different buildings, in different contexts, and she knew what it looked like when it met a document that made the downstream visible. Holloway finished the timeline. He looked at Calloway. Calloway placed his phone on the table, face up, with the document visible on the screen. He looked at Harlow. "Mr. Harlow," he said, "I'd like to ask you about your investment portfolio." The room changed. Not loudly. There was no dramatic reaction, no sudden noise, but the quality of the air in the room changed in the way it changed when the fundamental premise of a situation shifted, and everyone present was in the process of registering the shift at different speeds. Harlow's expression moved through several configurations in rapid succession before landing on the one he'd selected: mild confusion, appropriate for someone being asked an unexpected question. "My portfolio?" Specifically, the domestic holding entity registered as Crestline Meridian Partners. Calloway's voice was level. "And its transaction history over the past 26 months. The mild confusion held for approximately 3 seconds. Then something underneath it began to change. Not collapse. Harlow was not the type to collapse immediately. He was the type to manage. But the management effort became visible, which was its own kind of answer. "I'm not sure what my personal finances have to do with a procurement contracting network that financed the operational team that entered this hospital yesterday, moved funds through Crestline Meridian Partners beginning 26 months ago," Calloway said. "We have the transaction records." Silence. Garrett, the legal counsel, had stopped writing. He was looking at Harlow with the careful distance of someone who had just identified a conflict of interest in his own presence at this table. "I would need to consult with my attorney," Harlow said. His voice had changed. The warmth was gone from it. What remained was the flat, careful diction of someone shifting from social management to legal management, and the shift was fast enough and practiced enough to tell its own story. "Of course," Calloway said. "That's your right." He looked at the two suited figures at the table who Evelyn now understood had been here since early morning for exactly this reason. "Agents Marsh and Del Rio will need you to remain in the building." One of the suited figures, a woman, produced credentials and set them on the table in front of Harlow with the unhurried quality of someone completing a process that had been in motion for some time. Harlow looked at the credentials. He looked at Calloway. He looked at the Admiral. He looked at the table with the look of a man running a calculation that kept producing the same answer. He did not look at Evelyn. Greta Wills had her hand over her mouth, not dramatically, just the hand over the mouth of someone trying to keep their reaction from taking up space in a room where it didn't belong. Two of the other administrators were looking at each other with the rapid, uncertain communication of people who had just understood that the institution they worked for had a deeper problem than they'd been briefed on. Holloway let the silence have its moment. Then he turned to the table at large. "The board will be restructured," he said. "That process starts today through the appropriate regulatory channels. The hospital's security protocols will be subject to a full federal review, and every documentation action taken against nursing staff in this department over the past 12 months will be audited." He paused. "By an outside firm, not internal review." He looked at Evelyn when he said the last part. Not at the room, at her. She looked back at him steadily. The meeting ended. The agent stayed with Harlow. Garrett left the room with the purposeful walk of someone who needed to make calls from somewhere private. The administrators dispersed in the uncertain way of people who had just been told that the ground rules of their professional lives were being renegotiated without their input. Evelyn walked out of the conference room into the administrative corridor and stood for a moment in the carpeted quiet. The bruise at her collar had deepened overnight. She'd seen it this morning, a full bloom of purple and green at the neckline, and her shoulder had the persistent dull ache of soft tissue that had been asked to do more than it was ready for. She was tired in the specific way of someone who had slept 4 hours after a day that had asked for 12. Patricia appeared from the direction of the elevator. She stopped when she saw Evelyn. "I heard," she said, "word travels fast in a building like this." "It always does." Patricia looked at her for a moment. "Holt's credentials are formally suspended pending the medical board review. The board sent the notification this morning. Official letter, license hold, the whole thing." She paused. "He called the department, asked to speak with the charge nurse. I told him I'd pass on the message." Evelyn almost smiled. "What was the message?" "He didn't leave one." Patricia's voice was dry and precise. "I think he expected to say it himself and ran out of nerve." She looked toward the conference room. "The board member, Harlow. He's being held for federal questioning. Will he—" "That's not my part to answer," Evelyn said. "The review process will work it out." Patricia nodded. She had the look of someone who wanted to say something more and was deciding whether the moment was right for it. She decided it was. "For what it's worth," she said, "I should have pushed back harder on the first complaint, 6 months ago. When you told me it wasn't yours, I believed you, and I filed the dispute, but I didn't push." Evelyn looked at her. "You pushed today. Not hard enough 6 months ago." "No," Evelyn said. "But you called me about the pediatric wing. You locked it down when I told you to, without asking me to explain myself first. That mattered." She paused. "Nobody does everything right all the time. You do enough right, and you catch the rest when it comes back around." Patricia was quiet. Then she said, "Robert Okafor is asking for you. Pre-op is in an hour, and he wants to see you first." She went to see Robert Okafor. None. He was sitting up when she came in, already changed into the pre-op gown, which he was wearing with the dignified discomfort of a man who had objections to the gown that he'd decided weren't worth voicing. His daughter was awake, actually awake, not the duty wakefulness of the past 2 days, and there was coffee in a paper cup on the overbed table, and the room had the calmer atmosphere of people who had found their way to the same side of something. "There she is," Robert said. "How are you feeling?" "Like someone is about to cut into me, which is exactly what's happening, so fairly accurately." He looked at her face. "Rough night after the rough day." I got some sleep. Some. He studied her for a moment. My daughter told me more this morning, from the news. He held up his phone. There was a local news notification on the screen, a headline about a federal operation and a hospital security breach and 3 individuals in federal custody. They're not naming you. No, but she knows it's you, and I know it's you. He put the phone down. I've been in this hospital for 3 days, and I gave you a hard time your first morning because I was scared, and I took it out on the furniture. He looked at his hands. I don't usually do that. You didn't give me a hard time, she said. You were a project. I like projects. He laughed. It was an unexpected sound, full and real and slightly startled, the laugh of a man who hadn't expected to find anything funny this morning. His daughter looked up from her phone and smiled at the sound of it. I'll be here when you come out of recovery, Evelyn said. I'll check in with the surgical team and make sure you've got good handoff notes. You don't have to. I know I don't. She picked up the tablet and did a final pre-op check on his vitals. Stable. Good. That's why I'm going to. She was at the door when he said, Evelyn. She turned. You're a good nurse, he said. Not despite everything else you are. Because of it. She didn't have an immediate answer for that. She was not, she knew, someone who received that kind of directness gracefully. She received it in the way she received most things that required her to be present in a way that wasn't useful, which was with the slight discomfort of someone who had spent a long time making sure the quality of the work spoke for itself because speaking for herself had never felt like safe ground. Thank you, she said, and meant it. Sylvia Holloway was in a private room on the 2nd floor with protective detail at the door and monitors tracing steady lines and the slightly unfocused quality of someone recently returned from anesthesia who was working on coming back to full resolution. Her brother was in the chair beside the bed. He stood when Evelyn came in. Dr. Ferris said the hemothorax was fully drained, Evelyn said. The shoulder repair went well. She's going to have a long recovery, but the structural damage is manageable. Holloway nodded. She's been asking about you. Sylvia's eyes had tracked to Evelyn from the moment she'd entered the room, with the particular attention of someone whose body was metabolizing sedatives, but whose mind was already ahead of the process. You moved me, Sylvia said. Her voice was rough from the intubation, the words slightly slow but the intent behind them clear. In the ED, before they could find me. Yes. And the file. It's intact. It's with the federal investigation team. Sylvia looked at her for a long moment. The monitors beeped their small, regular beats. Outside the room's window, the morning light was coming in clean and flat over the Colorado roofline, the kind of winter light that had no warmth in it but was sharp enough to make everything visible. I've been carrying that file for 8 months, Sylvia said, collecting it, protecting it, moving it around. People kept telling me to let someone else handle it. Let the lawyers handle it. Let the investigators handle it. Let anyone who wasn't me handle it because I was too close to it and too exposed. She paused. Her jaw tightened slightly with the effort of the words. I couldn't let it go because I knew if I handed it off and the chain broke somewhere, nobody would pick it up again. Nobody had for 2 years already. Evelyn stood beside the bed. She didn't have a response that was equal to what Sylvia had said, so she didn't try to produce one. The board member, Sylvia said. Harlow. In federal custody this morning. And the 3 who came into the hospital. Already in custody since yesterday. Sylvia closed her eyes for a moment. Not in exhaustion, in the specific, deliberate way of someone marking something. The subcommittee testimony is still scheduled, she said. Next week. My doctors are going to have opinions about that. Your doctors are going to be correct, Evelyn said. You were in surgery less than 12 hours ago. I know. A pause. But the testimony happens with or without me. The file is enough. Then let the file do the work, Evelyn said. That's what you kept it for. Sylvia opened her eyes and looked at her. You understand that. Keeping something intact until it can do what it needs to do. She looked at the monitor, at the steady lines, at the numbers that said this woman was alive and stable and would get stronger from here. Yes, I understand that. So, the federal investigation formally opened its expanded inquiry at 10 a.m., with a press statement that named the contracting network, confirmed 3 arrests, and referenced an ongoing review of institutional governance at Harlow Memorial Medical Center without specifying Douglas Harlow by name. He would be named later in a charging document that was filed before the close of business, along with 2 other individuals connected to the network's financial structure: a procurement officer at a defense subcontractor and a former state budget official whose name Evelyn didn't know and would learn only through the news cycle in the days that followed. Gordon Holt's medical license was formally suspended at 11:17 a.m., pending the medical board's investigation into the fraudulent documentation and the unauthorized access to hospital administrative systems. The suspension was immediate and public. It appeared in the board's official record and was reported by the same local news outlet that had run the hospital security story. Evelyn learned about it from Trevino, who learned about it from the break room, which was how most consequential information moved through Harlow Memorial, regardless of what official channels existed. She was in the middle of a dressing change in room 8 when Calloway came to find her. He stood in the doorway until she finished. She stripped her gloves, disposed of them, updated the chart, and came out into the hallway. "It's done?" she said. "The immediate part." He stood with his hands clasped behind his back, which she'd come to recognize as his posture for delivering information he'd organized carefully in advance. "The review will take months. The prosecutions will take longer. That's the nature of the process." "I know." Holt will cooperate. His attorney has already indicated he'll give a full account of the access he provided. He's claiming he didn't know the operational application. A pause. "Whether that reduces his exposure is for a court to determine." "Yes. The documentation in your file, the 2 complaints, will be formally vacated. The outside auditing firm starts Monday. Everything in the nursing staff's disciplinary records from the past 14 months will be reviewed." He held her gaze. "You'll be contacted by the firm. It's a formality, but it's a necessary one." She nodded. The dressing change cart was beside her, and she started pushing it back toward the supply room, because it needed to go back, and standing still while receiving information didn't require her hands to stop working. Calloway walked beside her. "The consultation program," he said. "The card I gave you. I still have it. They've been briefed on what happened here. They're interested in what you built yesterday without any formal support structure." He paused. "The route through the maintenance corridors. The way you manage the 3rd individual in room 31 without a tactical briefing or a support team. The clinical decision-making under direct threat." He glanced at her. "They want to know if you'd consider a consulting role. Part-time. You'd stay in your nursing position. This isn't an either-or offer. It would be periodic. Crisis response protocol development, training design, scenario consulting." She pushed the cart into the supply room and positioned it at the wall. She thought about it. Not performatively, but actually, the way she thought through decisions that had more than one dimension. She thought about what she was good at. She thought about why she was good at it, which was not because of the training exactly, but because of the specific combination of the training and the work and the years of understanding what it meant to be responsible for someone's life in a context where the variables were not controlled and the outcomes were not guaranteed. She thought about the fact that those 2 things, the combat medicine background and the floor nursing, were not actually different skills housed in the same person. They were the same skill applied in different registers, and the transfer between them went both ways, and the value of that transfer was something she had understood for a long time, but had not found a way to make useful until yesterday. "Yes," she said. Calloway nodded once. "Someone will be in touch." He left. She went back to the hallway. Sam. At 2:30 p.m., a week into a shift that had technically ended at 7 a.m. the previous day and had never quite resolved into an off-duty period, Evelyn Marsh sat in the break room on the east wing and drank coffee that was slightly too bitter and looked at the wall. Patricia had told her 3 times to go home, and she had agreed each time and not gone, because Robert Okafor was in recovery and she'd said she'd check in, and because Sylvia Holloway's afternoon monitoring was due, and because the East Wing was where she worked and the work wasn't done. She was still sitting there when Trevino came in and poured himself coffee and stood at the counter looking at her with the forthright directness of a night shift nurse who had no patience for indirection. "The boy from pediatrics," he said. Marco. He asked one of the nurses this morning if the nurse from yesterday was coming back. She looked up. He's still admitted? Discharged this afternoon, but he made his mother take down the nurse's name before they left. He paused. He told the nurse he was going to tell everyone at school that the bravest nurse in Colorado worked at Harlow Memorial. She looked at her coffee. She didn't have a clean feeling about any of it. That wasn't really how it worked, and anyone who told you that justice arrived with a clean feeling had probably never been close enough to the real thing to know. What she had was the particular tired clarity of someone who had spent a long time holding something together and had finally been allowed to put it down, not because it was over, but because it didn't require her to carry it alone anymore. The false complaints were gone. The man who'd filed them wouldn't be returning. The man who'd funded the operation that had sent 3 people into this building was in federal custody, and the document that proved why was in the hands of people who knew what to do with it. Sylvia Holloway was alive. Marco Navarro had gone home. And somewhere in the administrative wing, behind a closed office door, the outside audit firm's preliminary contact had arrived in Greta Will's email, and she was reading through the scope of review with the complicated expression of someone who had spent years building a version of institutional competence that was about to be held up to light it hadn't been designed for. None of it was perfect. None of it was going to resolve cleanly into a shape that fit the story people told about justice afterward. The clean arc, the satisfying symmetry, the sense that everything had come to exactly the right place at exactly the right time. It was messier than that. It was Holt negotiating cooperation through a lawyer, and Harlow asserting constitutional protections through a lawyer, and a medical board process that would take 8 months minimum, and Greta Wills generating documentation as fast as she could, and all the smaller frictions of the real world that didn't pause just because the larger thing had broken open. But it had broken open. That was not nothing. That was, in fact, most of it. She thought about what she'd said to Robert Okafor's daughter in the corridor 2 days ago that felt like a different calendar month. Nobody does everything right all the time. You do enough right, and you catch the rest when it comes back around. She had not known, when she said it, that she was also saying it to herself. She finished her coffee. She stood up. She rinsed the cup and set it on the drying rack, because the break room had a drying rack and using it was a courtesy, and courtesies were the small architecture of being in a place with other people. She went to check on Robert Okafor in recovery. His daughter was there, and he was awake, and the surgeon said it had gone well. And Evelyn read his chart and confirmed the post-op orders and answered the daughter's questions with the patience of someone who understood that questions were how people managed fear. And the best thing you could do for frightened people was answer them honestly and completely. She checked on Sylvia Holloway. The afternoon monitoring was stable. Sylvia was more alert than the morning, the sedatives fully cleared, and she was on her phone, which the protective detail had evidently allowed because the number she was calling was, Evelyn gathered, her legal team. She walked the East Wing. She checked on her patients. She updated her charts. At 4:15 p.m., she handed over to Trevino for real this time, changed out of her scrubs in the locker room and stood for a moment at the locker with her bag in her hand. There was a piece of paper taped to the inside of the locker door. She hadn't taped it there. It was a sticky note in Patricia's handwriting with 5 words on it. You were right about the camera. She peeled it off. She folded it and put it in her bag because it was the kind of thing you kept even if you weren't sure why. The small, specific record of being seen accurately by someone who was paying attention. She walked out of the locker room, through the East Wing corridor, past the nursing station where the day shift was giving report to the evening team, past room 9, where Mrs. Delacroix's BP medication was correctly documented and correctly administered, and would be for as long as she was in that bed. She walked past the stairwell door, past the supply room, past the junction where the ceiling-mounted camera had its indicator light back on, and working. Someone had fixed it. She didn't know when, but it was on. She pushed through the main exit into the cold Colorado evening. The air was sharp and clean, and the sky had the deep blue quality of a winter sky an hour before dark, the mountains at the edge of the city going from brown to purple in the fading light. She stood on the sidewalk for a moment and let the cold be cold, which it was, without apology. She had spent 11 months in this city, making herself small enough to fit the space that had been assigned to her. Not out of deception, not out of shame, out of the particular weariness of someone who had operated at full intensity for a long time and needed, for a while, to be somewhere the intensity wasn't required. The problem with making yourself small was that the space didn't actually get smaller. The world didn't adjust its dimensions to match what you were willing to occupy. The maintenance corridors were still there. The cameras still went dark. The people who had learned to recognize what quiet competence looked like in order to exploit it were still making their calculations. And the only real answer to those calculations was someone who saw them clearly and didn't flinch at the sight. She was tired of flinching. She started walking home, 6 blocks through the cold, and what she felt was not triumphant and not resolved in the clean sense of a thing fully finished. She felt the bruise at her collar and the ache in her shoulder, and the particular bone-level tiredness of someone who had given a hard day everything she had and would get up tomorrow and do it again. But she walked at her full height. She didn't look at the ground. The cold air went in and out of her lungs with the easy efficiency of someone who had been here a long time and intended to stay. She was Evelyn Marsh. She was a nurse on the East Wing of Harlow Memorial Hospital. She was a combat medic who had kept soldiers alive in places that didn't appear on briefing slides. She was the person who had read the building's blueprints before she moved in, not because she expected to need them, but because knowing the layout of the place you were responsible for was the first thing you did when you decided to actually be responsible for it. She was not what anyone had decided she was before they looked. And the looking, in the end, was what everything came down to. The people who had tried to remove her from this building had looked at her record and seen a liability. Holt had looked at her face and seen someone manageable. Harlow had looked at the operational plan and not seen her at all, but the boy in room 31 had looked at her and seen the nurse, and sometimes that was the truest version of the whole thing. She turned onto her block. The lights were on in the apartment building, warm against the darkening sky. 6 blocks from the hospital. Close enough. She went inside.